Hi, everyone. I'm Ann Louise Gittleman, First Lady of Nutrition. I'm the New York Times bestselling author of over 36 books, and it's my pleasure to be the hostess with the mostess for the First Lady of Nutrition podcast. And today, I have a very special guest who's going to be talking to us about restoration healthcare, because all of us are aware of holistic medicine, we're aware of integrated health, we're aware of functional medicine, and we're aware of alternative medicine. But how many of us know about restoration or fusion healthcare? So on that note, I'd like to introduce my very special guest, Dr. Jana Hull, who is the founder of Restoration Healthcare here in Coeur d'Alene, Idaho. Welcome to you, Dr. Hull.
Thank you so much, Ann Louise. It's such a pleasure to be here.
The pleasure is mine. Okay, so tell my listeners why you, who are a very successful chiropractor here in the area, why you established a national healthcare facility called Restoration Healthcare. What prompted you to go into this arena of health?
Yeah, so as with many people's stories, it was kind of a winding road with a lot of different interesting things that all I feel led me to this moment, and they all had to do with people I love and care about, and seeing that I was doing amazing things as part of a practice with my husband where we were treating patients and family and friends and treating our patients like they were our family. And we noticed that over the years, sometimes for certain conditions, when people's bodies had degenerated to a certain point, like we couldn't bring them back from the brink where they were starting to have to get joint replacements and go in for various kinds of surgeries and fusions and things like that. And so it was a really helpless feeling when you dedicate all of your life to healing people that you care about, and then, you know, kind of getting to this point of feeling like a failure. So I had heard things about people using stem cells to regenerate joints and to regenerate the body generally here and there, but then a family member of mine actually used stem cells, and it was kind of like a last-ditch attempt to save his life when he had prostate cancer. And he was elderly already, so like we all knew that it was a possibility that it wasn't going to help him, but it was kind of this last attempt to get a little bit of quality of life for him. And he was actually part of a research project. And what ended up happening is we all got 3 amazing symptom-free years with a family member with stage 4 prostate cancer. And it just was so beautiful to let my 4 children get to know their great-grandfather and spend this like really great quality time with him. And they're never going to forget him now because they got that time. And I was just so intrigued with the idea that we can use something that comes out of our bodies, put it back into our bodies, and heal the body. So I just became passionate about it. And I started flying around the country, going to seminars and conventions and reading books and talking to experts. And I found out that something that I thought could, you know, maybe start prolonging people's lives could also prolong the lives of their joints, which was totally in line with my mission to help people live a pain-free life. And so we opened in 2019 and just started seeing not just, you know, knees and shoulders and hips being regenerated, but also, you know, GI tracts and lungs, and, you know, people, obviously we're not pitching this as a cure for any kind of condition, but we saw miracles starting to happen, and it was just undeniable.
So the miracles that you saw happening, is that primarily from special stem cell treatments? Are these special stem cells that you're able to harvest? Is it from a person's body? Is it from amniotic fluid? I'm so curious about where you're getting your stem cells.
Yeah, so the stem cells that we started with and that have consistently brought kind of the most miraculous type, I mean, it seems miraculous, but it's actually science and nature working together. But so we use the stem cells that are called Wharton's jelly, and they come from inside the umbilical cord after a baby is born. A full-term, perfect health, beautiful baby is, you know, brought into this world. Currently, 98% of the amniotic fluid and the umbilical cords are just thrown away in America. But people started realizing that the most powerful medicine in the world pretty much is held inside those tissues. So the companies that we work with would take the gel, the gelatinous material that protects the blood vessels that go between the mother and the baby. And the really beautiful thing is that those cells are called immune, they don't contain DNA, so that the mother and the baby would, excuse me, if these cells were to have too much DNA inside of them, either the mother's body or the baby's body would reject those cells and they would die. So these are called immune privileged cells, and they don't trigger that graft versus host response that we see when we have like an organ donation. So we were able to cut, tissue banks were able to harvest that gelatinous material that would have just been thrown in the garbage after a perfect birth. And they started using it in research and eventually found that it can actually, it's the only substance known to man to take degenerated cartilage like in the knee and actually regrow cartilage. So we're not taking anything out, we're not shaving anything down, we're not replacing it with metal and plastic. We're actually letting the body regenerate itself using those cells that came from the umbilical cords.
So this is completely ethical and moral. There are people that have concerns in that regard, and I just wanted to allay their concerns.
Yeah, absolutely. It's a fantastic question, and I totally understand why people are concerned. And we just like to tell people that we never have and we never will use any cells that were, procured through abortion. Not only are there, ethical concerns like you brought up, but also they're the completely wrong kind of stem cells. So there's, no reputable office in the world, no reputable clinic is using those types of cells at this point.
Well, I can attest for all this because as I think I told you, and I'm going to be going through your restoration healthcare program because I'm a believer. I, many years ago, had suffered a concussion through no fault of my own, but that is a completely different story for a different time. In any event, I had to get on some medication because I suffered from PTSD, and it affected the way that I operated. My brain was not functioning properly. I was told about the Wharton's jelly stem cells. At least that's what I called it. I'm sure that's not the official name. But I got an injection. It was a systemic injection. And it must have gone directly to the brain because within 3 days, I woke up saying, I have to write another book. Got up at 4 a.m. and I was like back in the saddle again. So my point being is that whatever your body needs, it's kind of like an innate healer. There's something in your system which can tell these stem cells where to go and how to proliferate and your best. So
yeah, that's exactly what they do. In fact, it's amazing that you kind of picked up on that instinctively, but that is exactly what the cells are doing. They have kind of like little homing beacons, and they're called to inflammation. And because stem cells are a blank cell, they basically have the ability to turn into any other type of cell. That's what makes them so unique. And when the body has like an area of damage or inflammation or even pain, the body will like work with that stem cell that's put in, whether it be, in an IV form like you had, or injected right into a joint. It will take those cells and start using them to rebuild that joint. And the cells, they actually sometimes call them medicinal signaling cells or mesenchymal stem cells. Those are two different names for those Wharton's jelly cells. And that's what they do. They call out and, find the areas that need to be fixed.
And it fixes them. I mean, I think people, when they get to be a certain age, I'm 70 years old, I think you need an injection every 4 to 6 months.
Yeah,
to kind of because the body, I mean, I'm totally serious, because there's a lot of repair work that needs to be done, a lot of restoration work, and you have no idea what really needs to be restored. So my point being is that this goes beyond just a joint or cartilage. I mean, can you start regenerating organs as well?
There is research being done on that right now, and it's early because we're just, you know, kind of getting back into researching the cells now that they're, you know, we have the right to use them at this point. But anecdotally, I can tell you that many people have experienced healing in organs. One of my family members actually had what was called a paralyzed colon. And so she was unable to eat food normally and, you know, eliminate it. And so she ended up being on a liquid diet for about 1.5 years. And I just saw her suffering and struggling, and it was really heartbreaking to watch. And so she was actually, came into my clinic the first day that I was open, and we gave her stem cells. And 2 days later, she texted me and said that she had eaten her first meal, you know, like a full meal in 1.5 years.
Oh my
And
goodness.
it was just a total game changer for her. She started being able to go to the bathroom normally. She was able to process food normally. And we still have to go, you know, dive deeper. And this is part of what we do here at Restoration Healthcare is like, we said, okay, we've got you some relief. You're processing food properly. Your GI tract is functioning, like it's not paralyzed anymore, but let's also dive deeper and find out what's really going on under that. And you know how many sensitivities and allergies people have to different foods. So we had to really dive deep with her to find the odd foods that she was partaking of every day, even in like the green drinks and the things that she was trying to live on in her liquid diet. Some of the ingredients in there were actually very, very bad for her. Even if they might be a great product, her body wasn't handling them well. So inadvertently, she was like making her problem worse over the years. So it's
So,
just amazing.
so you do a complete fusion. I like to call it fusion medicine. It's kind of like the best of both worlds. I
Yes,
mean, you do a
yes.
lot of clinical testing.
Mm-hmm.
So if somebody comes into the clinic, I mean, I came in and you did some digital imaging.
Mm-hmm.
Is
Yep. So
that,
we
is,
utilize the x-rays for sure. And then we also utilize ultrasound. But we like to do blood testing. I mean, you happen to be a person who's so forward thinking and aware of your body and your health, and you've been working on your tests for years. But most of our patients, they have no idea what's going on in their body. Like they come in, they know they have pain, but they don't know why. They know they have dysfunction, but they have no clue what's really happening. So we, a lot of times, we utilize like the tools of functional medicine, and then we combine it with physical medicine. So we're kind of wrapping them around with care, where we're looking at the outside of the body, the inside of the body, the function, you know, just kind of like trying to be like detectives, figuring out what's really going on with people and get to the bottom of it.
so you do a number of things. You do the blood testing, the allergy testing,
Mm-hmm.
and you also have a chiropractic aspect, a chiropractic arm, so to speak, of the clinic. So you work on the functional, because function and form are very interrelated. And you also
Absolutely.
do something else that I found very fascinating, and we'll have to talk about the platelet-rich plasma in just a moment. I want to get into that as well. But you
Mm-hmm.
have is it a sound? It's a kind of machine that breaks up adhesions or scar tissue, and I found that fascinating.
Yeah.
Can you explain
Yes.
that?
Yes, I would love to. It's such a fun thing for us, and maybe some of your listeners have heard of it, but I was not aware of it until I started looking into it for our clinic. But it's called the Shockwave Machine. And basically what it does is it's using acoustic waves that carry high energy, and they break through those, the scar tissue and the adhesions in the fascia and tendons. And it not only breaks up all of that and helps the joint to function better, or the muscle to function better, but also has this amazing ability to accelerate tissue repair and cell growth. So it actually is a type of regenerative medicine also. It has the ability to reduce inflammation, cause the body to build new blood vessels, rebuild cartilage and collagen, not cartilage, collagen, and like tendon sheaths and things like that. So it's pretty remarkable. We've been getting just unprecedented results after just a few visits. And so it's kind of becoming something that's growing really quickly. And our favorite is when we have a new patient and we can use all of these tools on the same person. So, you know, maybe they're getting 75% of their healing is happening because of the stem cells, and 15% is happening from the shockwave, and 10% is from, you know, manual hands-on work that we're doing. But all of that together is actually getting the type of results that people used to just dream about.
So your menu of services, I'm reading one of your beautiful brochures. We talked a little bit about the stem cell treatments. We talked a little bit about some of the blood work that you do, the lab testing, the digital imaging, a little bit about the ultrasound. I don't know if that's the same thing as your shockwave treatments, but tell me what your platelet-rich plasma is all about, because it's something I'm fascinated with, and your hair loss treatments in that regard.
Yeah, okay, so platelet-rich plasma is something, it's so low tech in a way that it's kind of amazing what it can actually accomplish, but it's kind of the similar lineup of effects that I just mentioned with shockwave. Essentially, we pull out just a vial of blood or two, depending on what we're doing with the plasma. But we take the whole blood and we spin it in a centrifuge, and all of the blood cells go to the bottom and the plasma goes to the top. And inside that plasma is just full of platelets and the things that go normally, like when we get an injury, let's say a cut on our arm or our hand, the body will send all the platelets to the area in that blood that's spilling out of the body. And that's what triggers blood clotting, scab formation, and then eventually scar tissue and healing. And so when we take that platelet-rich plasma and we inject it into a joint, it brings that same ultra healing cells, which in fact also have our own stem cells in pretty high quantities in that area, in that material. And so when we inject it, like let's say into the knee, it goes in and it starts going through and repairing the damaged tissues. So our favorite at this point is a lot of times we'll combine stem cells and platelet-rich plasma together in one treatment. So you're getting this like endogenous stem cells and exogenous stem cells, meaning, you know, from your own body and from outside your body. And one of the great things is it's, you know, this is a total of a 20-30 minute appointment to have these injected in, and immediately the healing begins.
So where would you inject them, Jana?
You can actually inject them pretty much anywhere in the body. We tend to do a lot of joints here because our mission has a lot to do with chronic pain and getting people out of pain. But you can do them, as you kind of briefly alluded to, into the scalp, which causes hair regrowth to happen. And they think that that has to do with basically the stem cells and those healing factors going in and re-energizing the follicles that have been laying dormant. So people get really fantastic results with that. Anyone can go on Google and do some like before and after pictures of PRP, and you'll see like pretty amazing things. But you can also inject it into the face. You can, you know, get rid of dark circles and use it as a plumper. And it's so great because it's natural. It was already in your body. We're just putting it back in your body. So you have very few, well, really no side effects. We've never had anyone with any kind of side effects. People also, you know, inject them into like feet and hands to deal with arthritis. And it really can go just about anywhere. One of the things that's kind of getting a lot of buzz right now is what's called a vampire facial.
I was just going to ask you about that.
Yeah.
You took the words out of my mouth. Yes.
Yes. So the vampire facial, you know, got popular because of the Kardashians, but it's essentially kind of like combining like collagen boosting treatments where you're doing little micro traumas to the skin, but combining that with the power of PRP. And so they utilize it to inject it into the face and like layer it onto the face after the facial. And people say that it's like a facelift. So it's pretty exciting. And then I do want to touch on one other area, and it's an area that we've recently built a package deal around, but you can take the PRP and inject them into like the sexual organs also.
Oh yes, they call it, is it the O shot or the P shot?
Yep. So for males, it's the P shot, and for women, it's the O shot.
There
So
you
it
go.
can help with like, you know, erectile dysfunction or things like that, but it can also help women who have suffered with, you know, being incontinent. And so, you know, compared to some of the surgical options that women are faced with in order to get through that, it's really amazing. And I haven't participated in any of those procedures directly, but I've heard a lot of good things from people who have gone through it.
What fun.
Yeah.
I can just imagine. But
I know.
I've had it done in the scalp, that I will say. And it made a huge difference. Years and years ago, I did something crazy, and I took this chunk out of my hair right near the hairline in the forehead, and people thought I was, yeah, it was the craziest thing. Don't even ask what I was doing with a vacuum cleaner. It just, but I did. But I did stem cells, not stem cells. I did PRP, and it made a huge difference. You can't even see that I lost anything. So,
that's true. I've seen your hair, and it's beautiful and you know, full and goes right up to the edge. So I would never have guessed that happened.
No, that's between us and now the whole world that'll be listening.
Yes.
So
Our little secret.
So tell us what else you offer that may not be on the brochure.
Okay, so our newest offering is one that we're all extremely excited about, and that is that is UV and ozone treatments.
Ooh.
So yeah, it really fits in with everything that we are already offering. So it was on our wish list as a group. We all wanted to start offering this to people because it kind of fits in with everything else. There's very little side effects. We don't have to worry about doing harm or, you know, the kinds of contraindications that you have to worry about with drugs and surgery. But it has the most powerful capabilities that we've seen. And so a little bit about me is I recently, about 3 to 4 months ago, I came down with COVID. And while a lot of people, you know, have very light, mild cases, for whatever reason, I happen to have a fairly severe case.
Oh, I'm sorry to hear that.
Yeah, so it was really challenging for me to get through because I just turned 40, you know, a month before I got COVID, and I felt really healthy and strong. And, you know, I have 4 kids and 2 businesses, and I'm like, you know, have really worked to be like working on myself, and I felt like a very powerful, healthy, strong person. And I was really brought to my knees and shown that my health is something I can never take for granted.
Yes.
And it's really something like you have to invest into it. And I think before that, like I had a value for it, but I was so focused on everyone else's health that I kind of just took it for granted that I was feeling good. And now I realize that I need to work at it and build myself up so that if God forbid anything like this ever happens again, or, you know, as I'm trying to fully recover from COVID, I need to be more proactive. So I'm getting the ozone and the UV therapy. And basically what it looks like is you start an IV line, pull out some of your blood, and then put it into a bag that you're hanging with saline solution. And then you use an ozone generator and create ozone and then inject it back up into your own blood cells. And then as the blood comes out of the tube, it goes through a machine that uses UVA, UVB, and UVC light spectrums. And then the blood travels through something called a cuvette, which is like a turbine kind of, is what it looks like to me. It's a glass tube, and as it swirls around in this spinning motion, it's exposed to all of those different lights. And basically, you know, bacteria, infections of different kinds, and like even things like mold and fungus, they just can't survive in that environment with being exposed to the light. And I think I didn't so much get to experience this myself, but patients have told me that, you know, their grandparents used to tell them to, like, if they had a rash, you know, go lay out in the sun or go outside. And I think what they were noticing was that if you could expose some of these infections to the sun, you would get a lot of, you know, it would bring down the infection faster than almost anything else. And earlier on, of course, we didn't have things like antibiotics and stuff, but now we're kind of coming full circle and we're realizing that we've been utilizing antibiotics to the point where they're not even working anymore. And so people are kind of like going back to older medicine treatments, and UV and ozone were developed in the early 1900s. They actually, in the 1940s, they declared that they had the cure for herpes. And here we are all these decades later, and we have progressed so much with medicine, and I'm very thankful for that. But sometimes we forget the things that worked, that were so cheap and effective, and, you know, that no one had a patent on, basically. And so we're excited to start offering that to other people now.
And I did those treatments in Germany many, many years ago. And I think it held me in good stead for at least 10 to 12 years. I mean, it was an amazing detoxification, cleanse, purification. So I'm so happy about that.
Yeah.
I have a question that just kind of popped in my mind. I mean, all these treatments sound so forward reaching and so healing and so integrative and wholesome and so forth. Does insurance cover them?
That is such a great question, and really probably the first question that we usually get asked. So the answer is yes and no. Different insurances have different coverages, but the exciting thing that has happened this year is Medicare started covering some of the stem cell treatments. And as I've talked to people who own stem cell companies and people who are thought leaders and educators, and what they are guessing is happening is that Medicare is doing a trial run right now because they were hearing so many good things about what stem cells were doing in joints that, you know, up until that point, people thought the only thing you could do was a knee replacement, let's say. And knee replacements only last about 10 to 15 years. So we have these group of people who are too young to have it done. You've got another group who are too old to have it done, and you have other people who are not healthy enough to have it done. And so those people were the ones that started getting stem cell treatments first, and they were getting such fantastic results. We think that what Medicare is doing right now is seeing if it's a viable option. And, you know, the average knee replacement can be $45,000 to $65,000.
Oh my goodness.
Yeah, whereas, you know, stem cell treatments, even with cash, you know, are about $4,000 to $6,000. So 10 times more expensive to get a knee replacement, and you don't have any guarantee that you're going to be better afterwards. So this is really the conservative option for the insurance and for the patient. So they've begun paying for certain products, and we have a whole department in our clinic that is their whole mission is to find out if your insurance covers something and, you know, do the paperwork and all this stuff. It's not fun for us. Like, we'd rather just be cash, but we realize that, you know, we have this group of people, the baby boomer generation, they have the Medicare coverage, and we want to help them utilize that. And so we've been really on the forefront and one of the first clinics in America to start billing Medicare for stem cells.
So then this leads me to my next question, one of my final questions. And that is, why should people come to Coeur d'Alene? I mean, I know we live here and it's totally beautiful and everybody is discovering it and exploring it, and the traffic is getting insane. But what do you offer? And you've got the most beautiful clinic that I've ever seen. It's just cozy and it's in downtown Coeur d'Alene. But what can you offer people that come from out of town?
Yeah, so I mean, you did take a little bit of the wind out of my sails, because I am sitting in my new patient lounge at the front of my building on Sherman Avenue and looking out at Lake Coeur d'Alene and the beautiful trees and mountains, and even with the cars going by, it's still beautiful. So I love being able to share this community with people from out of the area. but also, you know, I've kind of like handpicked this team of people who deeply care about other people, and we are constantly learning. I mean, there's a certain amount of continuing education credits that we are supposed to get as part of our license. And each of us have done 10 times more than those amount of hours to educate ourselves each year of the last several years, so that we can be on the forefront and we can provide these services that it's not what you're taught in medical school. It's not what I was taught in chiropractic school. It's something that we're learning day by day, and we're incorporating the very best treatments we can find. So, you know, I know that there are other amazing clinics in other towns, but I know that we are spending a vast amount of time and money and resources putting together these incredible options that I've never seen anywhere else. I didn't even get to go into some of the new and exciting treatments we're starting with the M-Sculpt machine, which is electromagnetic. And so we're using that in our rehab program and as a sculpting tool. So like, it's just, we have a commitment as a group to always pushing ourselves to work together and serve our patients.
Can you tell me just a little bit before we end about the team? I've met several of your team members whom I was very impressed with. But tell my listeners about the team that you've put together, some of the extraordinary healers.
Yeah, so the one that everyone is going to meet, because he, you know, is our medical director and does most of our treatments, is Max Holliday. So we affectionately call him Doc Holliday. He is a nurse practitioner and he's board certified. He also has a functional medicine background, and so he really brings the best of East and West. And he, his career was spent mostly at the Mayo Clinic, so he brings just a wealth of knowledge in his background. And he also is kind of an old, you know, he's been doing stem cell medicine longer than most people because it's still so new in America. So he's been doing it for 3 years. We've estimated that he's done over 10,000 regenerative medicine treatments, over 6,000 just on the knees alone. So there's nothing he hasn't seen. There's no surprises really anymore, but he treats each patient like they are new and interesting and someone worth getting to know and understand. And so that's Max. And then our chiropractor, who also runs our rehab department, her name is Dr. Melissa Trost. And she's just a wonderful doctor who was trained at my alma mater, Palmer College. And she is just really passionate about helping her patients get better. And she's really young, but we have so many people who come to us and tell us later, I've been to, you know, dozens or hundreds of different chiropractors. I've never met someone like her before. She just is incredibly talented. And then we have our case manager, dAlene Davis, who you got to talk with on the phone, and Louise, I believe, and then met in person too.
Oh, wonderful fellow.
Yeah, I mean, I'm definitely biased towards him because he's my little brother, but he's been involved in healthcare for many years. And when I started this clinic, I knew immediately that this is something that I wanted him to be doing it with me. And so I had a lot of work to do to convince him to leave his other amazing job to come here, but he has so much education and knowledge, and he really cares about people. And then we have a whole team. I won't get into all of them, but we have a whole team of people who are like the support staff in the background, who are, you know, helping with our cases and billing insurance and being friendly voices on the phone. And then there's me, and I definitely like to participate in patient care as much as I can. And we're growing right now too. We've been interviewing new practitioners, but I will tell you, I'm very picky and trying to just bring on the best of the best. So we're excited to grow.
Where would people find you? At restorationhealthcare.com?
It's actually restoration-healthcare.com.
Remember that dash, restoration-healthcare.com.
Yes.
Is there a number we can give to our listeners?
Sure, it's 208-930-0045.
208-930-0045. And then if people come in from out of town, is there a package deal that you offer?
Yeah, there is. So it would be best if they contact us to kind of go over like the exact pricing, because it will depend on the joints involved, and also if they were wanting to do more of a systemic approach or kind of a targeted approach. But we just love pampering our out of town guests. So if you look up the Coeur d'Alene Resort, you'll see the lodgings that we actually offer free lodging for anyone who comes out of the area to stay here. And we also provide travel assistance and helping people making reservations and flight arrangements and things like that.
Wonderful. So you use a very integrative approach to give people solutions to pain and dysfunction.
Yes, that's our motto.
Any other parting words for my listening audience? Because I find this fascinating. It's something that I'm very deeply involved with. I'm fascinated by everything that you've said. I've used some of your facilities, I've used some of your services, and I can just attest to how professional and friendly everyone is at your clinic.
Yeah, thank you so much, Ann Louise. We've just loved having you, and you're such an amazing, fascinating woman. I hope to be half as accomplished as you by the time that I'm your age, which I'm pretty sure you said was 50, right? You're 50 now?
We wish.
But we're just so excited to help people. And I feel like my whole life has kind of culminated to this moment of gathering all the experiences that have happened and then combining it with all of the things that, the best that research and that, this kind of like old is new medicine that we're kind of putting together that is very integrative, like you said, and like holistic in a different way, but holistic in that we are focused on the whole body, the whole person, and really we're just so fortunate to be able to serve people. And the more that people hear about us and tell other people about us, we're just so thankful for the opportunities to meet more people and bring joy to their lives.
So this is restorative healthcare, but it's restoration-healthcare.com. I need everybody to kind of Google them, look them up. They're a terrific group of practitioners where they don't give up on anybody. They're truly loving, heartfelt individuals, and I can attest to that. So I want to thank you, Dr. Jana Hull, for being my guest today.
Well, thank you so much, Ann Louise. I really appreciate you.
And I want to thank all my listeners for tuning in again to First Lady of Nutrition podcast, brought to you by Unikey Health Systems, the finest supplements for anti-aging, women's and men's health care. And I want to thank you all for being my special listening audience, and may you have lots of health, wealth, joy, peace, prosperity, and shalom. Talk to you again. Bye-bye. Hi, everybody. I'm Ann Louise here with just one more thing. Thank you so much for being a fan of my work. And if you like this video, please check out all my other videos. Please subscribe to my channel and turn on notifications.